Tonight's slideshow will have about 36 slides, so it's kind of an average length, although a lot of those slides are pretty much descriptive, and they are just presenting certain aspects of complementary and alternative medicine, so that shouldn't take too much time. There is something specific that I would like to discuss with you tonight, which is the connection between logical processes, and philosophy of medicine. And the reason why we do this is to better understand the scientific methodology behind peer review, so that when you are accessing information on the internet, you'll be even better prepared to understand which one is solid evidence and which one might be interesting from a broader curiosity standpoint, but it doesn't provide solid data. So let's begin by sharing my screen and jump right in the PowerPoint. And as usual, the PowerPoint is already available in the module. And one more thing I would like to mention, I send out a quick message to all of you, is that this week marks the very real assignment, the first assignment for this semester, which is the first quiz. Now, the quiz will only be due at the end of this week on the 18th, I believe. I don't remember if I set up for 10 p.m. or midnight. I think it's 10 p.m. But anyway, it says in the module. And this will be a quiz that will give you the chance to understand the testing style of this course. Now, the recommendation is this quiz is a closed book, and of course, I use the term recommendation because there is no way that I will be able to verify your honesty. So I just trust your ethics in this context. So this will be the very first one for this semester. And so the content itself of the quiz will be focused on what we discussed so far in this 2.5 weeks at this point. Now, not every quiz will be cumulative. So for instance, in quiz 2, you might find 1 or 2 questions that might pertain to this slideshow, but otherwise, each quiz covers the topics in between these 2 assignments, with the exception, of course, of the final quiz. All right, and if you have any question, feel free to use the chat room to ask me those questions, or just raise your hands. I'll be happy to address them. All right, so as I mentioned, main topics here taken from chapter 2. As I mentioned before, the textbook is a support for your learning. So I'm not expecting you to master all the detailed content of each chapter, including this or that specific analysis, but the topics are taken from this part of the book, and they have to do with clinical reasoning, hermeneutics and psychology, logic in medicine, and medical philosophy, method, and research strategy. All right, so let's begin with the first slide here. Complementary, alternative, and integrative medicine. Does it work? Is it safe, and is it real medicine? And then the last one, of course, because we're talking about the method, is it based on real science? Now, this is a quick meme that I found on the internet, right on this picture here. It's a real reflexology chart where both right and left foot have several numbers, but at each number corresponds the term nothing. And this is one of the tongue-in-cheek jokes that you can find in a form of a meme from Western biomedical perspectives that claims that anything that has to do with CAM, it's not really solid science. So at best, it would work as a placebo effect. So just something that people might utilize to make themselves feel better, but without the presence of real biological mechanisms. So let's see if that is true. Let's begin with some discussion of the parameters that we need to use to identify whether the research is valid or not. And the first person I would like to talk to you about tonight is Sir Bradford Hill. So who is Bradford Hill? He was an English epidemiologist. And so he wasn't a physician, but he was a medical scientist with a specific focus on applied research. Some of this medical applied research is very often known under the term translational medical science. There is even an intradepartmental program at UVM called Translational Science. And the idea here is to convey knowledge that we get from the laboratory, from the clinic, from direct patient care into social applicability. We will talk more about translational science in week 6, I believe. But for now, I just want you to remember his name. So what did he do that warrants, us remembering his name? He developed this 9 criteria called the Bradford-Hill criteria to establish scientific evidence, not just clinical evidence for specific patients, but epidemiologic evidence of a causal relationship between a presumed cause and an observed effect. Now, for the ones of you that are familiar with statistical methodology, it will not be too complicated to remember the difference between causation and correlation, but the idea is here. The idea is this: you cannot just claim that something works unless you're able to link cause and effect in a logical manner, okay? So let's take a look at some of these criteria. And again, feel free to interrupt me anytime if there's something that doesn't really make sense. And I will ask you questions as we go. All right, so let's begin with the first 3 of these 9 criteria: strength, consistency, and specificity. Beginning with the first one, this concept identifies the size. And by the size, we mean the statistical size and the laboratory size, the size of your group, of your subjects. More specifically, a small association does not mean that a causal effect is not there. However, the larger the association, the more likely that it is causal. For instance, let's assume that you have 100 subjects in your population. Of these 100 subjects, let's say 8 subjects have a presentation, a clinical presentation that includes high temperature, increased blood rate, and some variation of oxygenation level. And of these 8 subjects, only 4 subjects were exposed to a bacteriological infection, for instance. So in this context, you have problems on both sides: the very size of the problem and the size of the people. So 8 out of 100, which is very, very small, okay? Now, of course, if the opposite were true, in your 100 subjects, 91 subjects will suffer from headache, for instance, after having eaten a specific food, for instance, that you might relate that to a possible causal effect because it's a larger association, okay? But again, this simply means that it's more likely that it is causal. It's not enough. In fact, none of these 9 parameters alone provide any sort of causal relationship. The more, the better. Number 2, consistency. Consistent findings observed by different persons in different places with different samples strengthens the likelihood of an effect. Now, this is to some extent common sense, but of course has to be included because it has to do with replicability of scientific studies. Just because you find one single study that claims to have found a very solid evidence for this association, it is just one study. So the more you replicate these studies, the higher the likelihood that you find something. Specificity. Now, specificity in statistics does not mean specificity in other areas of scientific investigation. So let's just focus on this very definition. Causation is likely if a very specific population had a specific site and disease with no other likely explanation. The more specific an association between a factor and effect is, the bigger the probability of a causal relationship. Now, this seems to be quite self-explanatory, but I want to point out some issues that you might find in mind-body medicine. And by mind-body medicine, I don't just mean complementary and alternative medicine, but I also think of those branches of medicine that by definition have to do with mind, neurological, psychological processes, and biological ones, for instance, psychiatry. Now, if you think about a specific sign disease with no other likely explanation, what do we mean by that? Well, by likely, we mean scientifically informed, not yet scientifically demonstrated, however. So the likelihood really represents something that is based on previous empirical observation. So to give an example, have you ever heard of terms such as conversion disease by proxy or Munchausen syndrome? Have you ever heard of this term before? Please either say it or write in the chat, in the chat box. No. All right. So those mean exactly the same thing. That the Munchausen syndrome is just the old term. I'm going to spell it right here for you. This is Munchausen syndrome. It's one of those clinical presentations in psychiatry where a person might be convinced that they have a medical or psychiatric issue, all right? And because of that, they will take action. So they might start to assume supplements. They might even schedule more or less invasive surgeries. They might start to change their diet, change their lifestyle, okay, with the absence of anything, quote unquote, real happening to their bodies, okay? Now, of course, this is true for a person that is both the person experiencing the issue as well as the person treating it or seeking help to treat it. So if I am affected by Munchausen syndrome or conversion disorder, what usually happens is this. I feel, for instance, that I have, I don't know, some sort of cancerogenic process, and I really want my PCP to schedule an appointment with oncology, for instance, despite the fact that my primary care physician does not see any of the sort in any of the blood work and the studies that this person has done. But of course, there's always a patient-centered benefit of the doubt in this sense. It is more complicated if within these parameters, rather than thinking of a specific symptomatology that causes pain, for instance, it's something that simply has to do with variation in my body. So within these parameters, you might have other types of problems. One will be the so-called Cotard syndrome. Let me spell here, Cotard syndrome. And again, this is not a full diagnosis, it's not a problem, it's a syndrome, therefore a clinical presentation. In Cotard syndrome, which is already another very complex psychiatric presentation, the person affected by it believes that their body is rotting from within. So they're progressively losing all their internal organs. Okay? They're rotting, they're disappearing. Now, these people, for the most part, do not have any other behavioral problem, namely they can eat, they can drink, they can walk around, their urinalysis and fecal analysis are somewhat stable. And so this will be counterintuitive, countercognitive for them to believe that they don't have organs, since their digestive process is entirely intact, and yet they do believe that their body is dying. Now, of course, because of the psychological pressure that this individual receive, they might in turn decide not to eat anymore because they deem this as improper or simply pointless. So those will be examples that don't have any specific medical reason to be there. They also, based on the fact they ruled out all blood work and other types of analysis, so no other likely explanation. But there's another level. In both situations, we might have something that we call by proxy, okay? So by P-R-O-X-Y, okay? So conversion syndrome by proxy, Munchausen syndrome by proxy, that affect a person close to us. And this is very, very complicated, both from a medical as well as from an ethical standpoint. Classical example where a person believes that the other person is affected by a medical problem, and they force them or try to educate them to change certain patterns of behavior related to medicine. Maybe a good example would be a parent who is convinced that their child suffers from anemia, and they start to change the child's diet for this false assumption. Unfortunately, many cases in history of by proxy syndrome affected healthcare providers, where nursing staff, sometimes referred in pop news, pop science as angel of death, were administering very dangerous amounts of this or that supplement or this or that drug because in their mind, this would have saved their patient, but eventually they were detrimental for their well-being. Now, this is a very specific example within psychiatric disorders, not something that we would necessarily associate with health in general, but as you can see here, this will be considered a magnified placebo versus nocebo effect that we can find in a multitude of medical disorders. So this has to do with specificity, okay? All right, so let's continue with 4 through 6, temporality, biological gradient, and plausibility. Temporality, the name temporality has to do with tempus and templum in Latin. So this is a term that confines 3 different aspects. So tempus as in time, so passing of time, tempus as well as in atmosphere or weather, so passing of time from an atmospheric standpoint, and tempus correlated to templum, which has to do with temple, okay? So with the sacred element. In any case, this is representative of a logical sequence. So temporally, as in chronological concept, according to which a certain effect has to occur after the cause. Now, again, this seems to be straightforward, right? I have an infection, and therefore, chronologically speaking, afterwards, I feel pain, for instance. Furthermore, if there is an expected delay between the cause and expected effect, then the effect must be occur after that delay. Now, this seems to be straightforward in medicine, and yet you have certain conditions that are predicated upon a sinusoid chronological time frame. So there might be more or less evidence in a curve, okay, in ups and downs. So it's really hard to monitor temporality to see what triggers it. For instance, this is very true for any type of head-to-toe assessment that we do in any hospital, where the nurse has to decide when to distribute an IV, for instance, okay? So the logical sequence from a logical standpoint. Biological gradient, number 5, greater exposure should generally lead to greater incidence of the effect, though in some cases, the mere presence of the factor can trigger the effect. In other cases, an inverse proportion is observed. Great exposure leads to lower incidence. Now, let's spend a few seconds on this one. This has to do with very much the old debate between allopathic and homeopathic medicine. Okay? Allopathic versus homeopathic medicine. Now, we mentioned this briefly last week. Well, the term allos, sometimes spelled with the H on top, is Greek for other, right? And the term homo is Greek or Latin for same, okay? So the general idea is this: homeopathic medicine uses the same thing to cure itself. Allopathic medicine uses something to go against this disease, right? So by allopathic medicine, we generally mean Western biomedical models. So an antibiotic, the antibiotic, because its name is anti-bio, right? Meaning against life, it's a form of allopathic medicine. What do you mean by against life? Well, the antibiotic goes against the life of, let's say, the bacteria, okay, a living being, so to speak, that causes problems, and therefore you have to go against it. The homeopathic medicine, it's a form of medicine that uses the same portion of the problem to stimulate the opposite immune-responsive mechanism, just as vaccination, okay? So in general, you have direct proportion, okay? The more, the better, okay? But sometimes you have to do the opposite. Classical example would be any type of vaccination that has to be constructed in a sequence, for instance. You don't get everything at once. You have to delay the first and the second and third dose. Okay? All right. Number 6, plausibility. A plausible mechanism between cause and effect is helpful. Now, you might wonder, you need to ask a British epidemiologist to have this. And yet, it is not enough to notice something. You really have to figure out how the link works, okay? And that's the difference between a process and a mechanism. A process is something that simply occurs in a logical, chronological sense, okay? A, B, C, and D, that's a process. But it's not enough to link those letters. You have to tell how those letters are related, okay? And by plausible mechanism, generally speaking, we mean biological, biomechanical, biochemical mechanism, at least in the Western sense of the term. The example here would be the comparison between the nervous system, okay, and acupuncture. If you remember, we briefly mentioned this last week. Now, where the nervous system is generally speaking divided between the central nervous system and the peripheral nervous system. And of course, you have, other subdivision, right? The autonomic, somatic, et cetera, But the general idea here is that you can follow the neural pathways, right? You can, with a very high degree of certainty, you can tell where the pathway is occluded, obstructed, or prevented from delivering a neurotransmitter message. Okay, think about the crossing over of the spinal cord, which we call decussation, right? You can tell where it happens. In acupuncture, because of the lack of biological plausible mechanism, acupuncture as a field is very often dismissed as either ascientific or anti-scientific by Western medicine, because the mechanism of chi, right, C-H-I, also spelled like this, which is a term for vital energy. Sorry, let me spell energy, or energy flow, does not make sense. Okay. All right, let's continue. Coherence, experiment, and analogy. Coherence between epidemiological and laboratory findings increases the likelihood of an effect. This is especially true where in the best case scenario, you have all the right things in the lab. So you have your double-blind randomized control trial, and yet there's something that doesn't translate in the practice that you have with a specific group of patients. Okay, so that the more coherent things are, the better the results. Okay, and this simply has to do with the fact that at some point you need to apply what you observe. So what you find in terms of the results of a pharmacological prescription done in a case control study, it's not fully valid until you have the chance to observe that in the general population. 8, experiment, and this is a direct quote from the text of Bradford Hill. Occasionally, it is possible to appeal to experimental evidence. Now, this is quite interesting because experimentation, from our Western standpoint, is the primary way to verify whether something is scientific, right? And yet, it's toward the bottom of these principles in Bradford Hill. It's the 8th out of 9. Okay, occasionally, it's possible to appeal to experimental evidence, which is exactly why, even from a very strictly logical perspective, you cannot simply disregard a lot of complementary alternative medicine, because the idea is this: complementary alternative medicine is really patient-centered. It's not against statistically evident mechanisms, but it does not take it focuses on the fact that a specific remedy works for that specific person at a very specific time. Okay, so it kind of goes against what we said about repetition. There are conditions cannot be predicated on anything else by the direct presence of the client or the patient. All right, so if you can do an experiment about it, more power to you, but it's not the sine qua non condition. Sine qua non is this term that we use in Latin, especially in the context of theoretical medicine, for a condition without which, okay, it's not the primary condition. It might be necessary but not sufficient, and even this sense of necessity is only predicated upon the presence of everything else. Let's finish strong here with analogy. The effect of similar factors may be considered. All right. Now, this would be the bottom of the pyramid. If you remember, the pyramid of evidence we discussed in week 1 had at the bottom saying such as direct observation, case reports, healthcare provider account, and comments. Okay, without any specific statistical analysis. Okay, so in the absence of anything else, assuming that certain things appear the same is in itself a good factor, okay, to begin your investigation. All right. Any comments so far? Do this all make sense to you? All right, great. So let's move on and see. So keep this as your primary way to interpret what we're about to say next. Now we will delve right into alternative medicine, okay? And we'll see what is it all about. So let's begin with the first slide, okay? So the first slide links those 9 parameters with what we mean in, what we observe in alternative medicine. He'll observe that in regard to the discovery of mechanisms, our current medical ability depends on its historicity. What does it mean? Well, it depends on the amount of knowledge, both technical, so verifiable, empirical, and theoretical, which means philosophical, achieved up to a point in time, which means that we think we know, but we only know a portion of the science at this point. So if something goes against our scientific knowledge, it might not be because it's wrong, but simply because we were not able to demonstrate that. Think about what we said last week in regard to the germ theory of disease. He notably added that as a result, none of my 9 viewpoints can bring indisputable evidence for or against the cause and effect hypothesis, and none can be required sine qua non, without which. Furthermore, he also made sure to evidence that lack of such evidence cannot nullify the epidemiological effect on association. So you might see something for which you cannot fully account the mechanism, okay? All right, now, I hope this makes sense so far. And the only reason why I bring this to your attention in week 3 is because if you have a claim that this or that CAM technique, it's not scientific, well, before this claim can even be made on a theoretical sense, the person has the burden of proof. In other words, they had to demonstrate why it does not work. I don't say this lightly because as we will discuss here, there are plenty of snake oil sellers out there, pseudo gurus and improvised naturopaths that really work on the gullible, misplaced hope that patients have. But at the same time, just because something does not yet make sense, you cannot simply disregard that as anti-scientific. Okay, you really have to give a solid explanation of why that is. All right, so let's start with slide 9, which is the very first definition. Now, you might not be able to see this very well because the fonts that I chose here, the color kind of blind with the background. So I will read it for you. So how about natural medicine? Can we apply all these 9 parameters to natural medicine with success? Let's see what we mean by natural medicine to begin with. And I will use this as a chance to give you some specific advice on what to consider for your career, okay, where you want to become a natural practitioner. So we'll see what we mean by that. So what do we mean by nature in natural medicine? Well, then the term itself comes from the Latin natura, all right, which indicates what is ready to be born or not yet born or in the process of being born. So it's an ongoing process, okay, has to do with nascere, which is a term for being born, or terms such as native, right? So something that is in the process of being born, which also means that it does not come from nothing. It's a constant evolution. I think about plants. The term, okay, is related to the Greek physis, which is the translation of nature. So physis in Greek means also nature. Think about physiology or pathophysiology, things of physical exercise, physical education, anything has to do with the natural body, okay, the matter, okay? Now, physis is in itself related to phys or phio, okay, which is both light and life. Okay, so in the Indo-European root of the term, these are synonymous. Okay, so it's something that exists as a living thing. So whenever you think about natural medicine, you don't think of things that are either naturally obtained as opposed to chemically obtained in the laboratory, but you take in something that has life in itself, okay? Now, this might sound mystical at first because, the term contains life, might give the false impression that something about flow of energy here. This might be true for certain branches of traditional medicine, but the idea is this. certain practices, and to give you a straight for example, I can think of Ayurveda, consider the plant as a whole being. So each part of the plant, whether we're talking about the root of the plant or stem of the plant or the leaves of the plant, are containing in themselves different aspects of this energy level, this vitalistic level, okay, vibrational powers. And that's how they are utilized in the context of prescriptions, okay? It's a very, very important thing to say. Now, of course, natural medicine in itself, it's a non-verifiable term in the United States. And by that, I mean, it's a term that's not registered, okay? We will talk more about pharmacology in week 11 and herbalism, but for now, keep in mind that if you are taking a supplement that simply says on its label, natural medicine, natural supplements, it doesn't really mean anything, okay? Natural, it's not a registered label, term, or concept, and therefore it is not synonymous with things such as organic, for instance, or locally sourced, okay? Natural doesn't really mean anything, unfortunately. All right, so this is a general parameters. Now, how about we play the devil's advocate and we try to figure out things that are really, really against complementary and natural medicine. Slide 10 indicates 3 websites that I really encourage you to browse. They're among the best websites to demolish any gullible idea around natural medicine, okay? Now, the slide I'm showing here does not represent an endorsement from my side of this specific website, but it's always good to know the other side. Let's start with the first one, quackwatch.org. It's a website that one single physician or researcher, Stephen Barrett, who's a doctor, the medical doctor, created, I believe in 2003 or 4, to really monitor what was happening on the internet and really catch all these pseudo improvised natural practitioners for the purpose of defending the population. Okay, so that there is a little bit of legislative/legal attitude in Quackwatch. Now, the terms and description he uses are at times not something I find myself in agreement with, but if you ever doubt the honesty of a specific practice or practitioner, Quackwatch is a good place to start. Now, this does not mean that Quackwatch has the ultimate truth. In fact, there's a lot of misconceptions and caricaturesque straw man descriptions of natural medicine, but it's nevertheless a good place to start just to see what's out there, okay? It's very easy to navigate. So let me just do this and show it to you real quick. Or you know what? I'm going to do this for the next one. You can just click on it or just copy and paste in your browser and see how the website works. It's very old school in terms of the aesthetic. I don't expect anything fancy, but you find a lot of information. The second one is really not a scientific source. It's really meant to be a fun comedian criticism type of website, mimicking Wikipedia, of course, which is in itself a horrible website to find scientific evidence. I keep saying this in every class: do not trust Wikipedia. If you really want to use Wikipedia, please scroll down and look at the original sources and see if they're reliable. But this is rationalwiki.org that really treats everything the same way, whether we're talking about natural medicine, to osteopathic physicians, to theology, mysticism, and anything that is in their mind not rational enough as dangerous nonsense, okay? I also want to mention something in this context. Now, let me see if I can do this with you live. Let me stop sharing for a second, and I will open another browser here. Let me see if I can do this. And then I will share this with you. Let's see. All right, so let's see if I can do this. Okay, good. I will open. All right, I think this is great. Let me just make sure that I close everything that doesn't pertain to this class. All right, so I do this experiment every semester, and the web never ceases to disappoint me. Now, what I'm about to say here has to do as much with medicine as well as with social and social criticism. So if you Google terms such as alternative medicine, natural medicine, complementary medicine, you will most likely get the exact same results on the premise that most search engines utilize very similar algorithms. So whether you research that on Google or Bing, you will most likely get the same results, okay? Now, I'm not the type of person that believes in conspiracy theory, but I dare to say that those algorithms utilized by these corporations really provide a skewed picture of what complementary alternative medicine is, for the right reason, because you really want to make sure that what is tested and scientifically honest should be on the top of the search engines. But very often this goes against some of the research that simply is not popularized enough. So one of the first results that you find when you type natural medicine or ethnic medicine, alternative medicine, is a Wikipedia page, which is nothing, nothing surprising that. But what is really concerning is how different types of medicine are treated. So if you click on natural alternative medicine, you'll be redirected to various pages on Wikipedia. And to give you a comparison, if you click on one or the other, you have very different results. So from alternative complementary medicine, then you have the choice to pick which geocultural areas you're more interested in. So see what happens, for instance, if you click on, let me see if I can pull it up again. What happened? Give me 1 second. Did I just lose the page now? Oh, just lost the page. All right, let me do this again. Give me 1 second. All right, 1 and 2. All right, good. So let's see what happens if you click on this or that part of what Wikipedia suggests. So where is the share screen? All right, so right here, I will share with you, see if I can do this now. What happens if you decide to go on traditional African medicine, okay? Now, the article itself, it's not bad. It gives you a general overview of all the history, the diagnostic treatments, traditional medical practices, et cetera, including criticism, all good. But immediately, this article, I hope you can all see the page. Can you let me know if you see the page? And if not, just type in traditional African medicine. Immediately, what you can see on the right-hand side of the article is this article is part of a series on alternative medicine, okay? Now, the descriptors about alternative medicine are extremely biased, okay? Right underneath the markers here, the label, you find conspiracy theories and a variety of issues here, okay? So fringe medicine as science, pseudoscience, dangerous practice, etc., etc. Now you might wonder, okay, well, this might be created on a safer side. So Wikipedia might be biased, but you might say, well, it's a justified bias because people should be informed of the fact that among alternative medicines and traditional medicines, there is a lot of very suspicious activity. Fair enough, okay? Unless this is only applicable to traditional African medicine. Now, if you type traditional European medicine, okay, you will be directed here, medicine in ancient Rome and medicine in ancient Greece, okay? I just pick one. I hope you can see the page as I switch the page. Now, in this article, you can scroll down all the way to the bottom. There is no indication of pseudoscience, fringe theory, or any of that sort, okay? Now, of course, I might be biased. You know, I was born in Europe, so of course I'm a proponent and defender of traditional European medicine. What I really find suspicious and quite anti-scientific is to say that, well, central traditional African medicine is really shamanism and jumbo pseudoscience, of people that are uneducated and just fringe theory and conspiracy, versus traditional European medicine, is true history. We don't practice that, but it's a respectable history, part of medical evolution. Now, this is very concerning to me, the way the article is constructed. Now, they don't necessarily present false statements in themselves, but in the way that are presented to the general public, really don't do a good job in describing how that actually unfolded. We mentioned this before, and we'll talk about this in week 5 as well, that the artificial divide between the African continent, the India subcontinent, Asia, and Europe, it's very artificial, because historically speaking, this simply did not make sense. So whenever I talk about those skeptical websites, be careful, because just because something appears to be quite scientifically minded, very often they have in themselves confirmation bias to the extent of presenting data that are really not reliable. Does that make sense so far? All good? All right. Fantastic. Thank you, Lisa. You were so kind in replying. I hope everybody else is still there. Let me go back to the PowerPoint. So, all right. So Quackwatch, Rational Wiki, and on the third one is science-based medicine. Now, science-based medicine is, I would say, that the most scientifically informed on them all. First of all, because all the authors, or I wouldn't say all the authors, but I believe about 85 to 90% of the authors that write for science-based medicine are either physicians or scientists. So they're not improvised journalists. And again, nothing against journalism per se, but the people that comment here have both, the technical ability to write as well as research background. And the website is extremely biased, so you will not find anything in support of Ayurveda, of yoga, of meditation, of Tai Chi Chuan, traditional Chinese medicine, herbalism. It's extremely biased, but at least what it does in a very good way is for every claim or anti-claim they made, they provide scientific references. So, and they're all clickable, so it's very easy to navigate. So it's similar to Wikipedia in a sense that everything is hyperlinked. But the interesting thing is that those links direct to very respectable sources, such as PubMed and so on, and the Library of Congress, et cetera, et cetera. So 3 websites that I will suggest you browse from time to time to see what else is there. Okay, so from the devil's advocate perspective. Slide 11, it's the opposite. Okay, website that really promotes complementary alternative medicine. Now, are these websites reliable? Well, the first one is the NIH, and sure, we can have a lot of criticism for our governmental institutions in the United States, but I certainly do believe that the NIH overall, it's a wonderful institution, a very respectable institution that really cares about science, not so much about politics. Now, of course, there will be a situation where those things kind of merge, and vaccination might be one of those areas, but I do respect the scientists that work for the NIH. Now, the NIH has this subfield, which is called NCCIH, that focuses entirely on alternative medicine. It used to be called the National Center for Complementary and Alternative Medicine. Okay, so if you have an older URL, these will reflect the old acronym. Since 2015, I believe they switched into National Center for Complementary and Integrative Health. So NCCIH at NIH. This website, it's less, I wouldn't say it's less easy to navigate, but it's less clickable as a previous one, but it does a wonderful job in presenting the most current research in any field, really, within complementary medicine. So you can just go in, you can click and insert acupuncture, and you find the most research analysis or meta-analysis in that field. So it's a wonderful place to find support for this or that therapeutic techniques, or honest debate. For instance, if you type in homeopathy, the NIH will not simply endorse homeopathy as yet another complementary alternative medical practice, but will clearly indicate that the statistical analysis does not provide yet solid evidence for this practice. They're very, very honest. And it's done in a very scientifically minded way. So it's a wonderful, wonderful website for your own research. And if in the future you might be interested in doing this for a living, becoming a medical researcher, then the NIH, of course, also creates opportunities and grants and workshops, all dedicated in this specific case to complementary and integrative health. The second one, the AAPS, okay, it's a website that's more theoretical, opensciences.org. And this is not just about medicine. The AAPS is this nationally based but international organization that it's called Academy for the Advancement of Post-Materialist Sciences, okay? Again, the AAPS is entirely constructed around the work of very, very respectable scientists. Some of them are biologists, some of them are physicists, mathematicians, neuroscientists, medical sciences, scientists, and so on and so forth. And the general idea within Open Sciences, including the Post-Materialist Manifesto that you can find in this website, is that the current scientific paradigm is completely outdated. And by scientific paradigm, we mean a materialist reductionist science. Now, if you want to find out more about this, I want to share something with you in the chat, okay? From the theoretical standpoint, this has to do with materialist reductionism. Oh, let me spell it. Or reductivist materialism. And more specifically, in terms of the current research in theoretical sense, the work by Paul and Patricia Churchland. Okay. The general idea is this. Once you remove everything that in their interpretation is pseudo-scientific or folk pop scientific, you're only left with matter. So it does not make sense to tell people about energy, because energy does not exist per se, unless you want to use energy in a very specifically materialist sense in Newtonian physics. Never mind talking about quality or quantum mechanics, all nonsense. It does not make sense to share thoughts about emotions that are disconnected from neural underpinnings. It does not make sense to say anything about spirit or soul, because those are all things that are predicated upon an immature and childish way to understand things. Now, some of these things have to do with philosophy alone, so the free will debate, for instance. But from our perspective, this is entirely what the post-materialist manifesto goes against: a misplaced faith in a world that only considers matter as a primary way to understand the world. So I will leave it like that for now, but I really encourage you to take a look at the website. All right. So this is the AAPS and opensciences.org. The third one is naturopathic.org, Naturopathic Physicians, Natural Medicine Real Solution. And this has to do with the American Association of Naturopathic Physicians. Now, let's take a little break here, because I really want to be clear on who are these naturopathic physicians. Okay, so the website, naturopathic.org, is the equivalent for naturopathic medicine of the American Academy of Medicine. Okay, so all the individuals, professionals in this website are doctors, naturopathic doctors, licensed doctors, not just registered or certified, they are fully licensed. Now, let me stop sharing for a second, because this is the time where I feel I need to explain to you the differences between these professions. Take a sip of water. So that, assuming that you like the course, you complete the semester, and you understood everything we discussed so far, and you decide to embark in a naturopathic career, whether you want to go to medical school and then you specialize in some integrative practices, or you decide to go to a naturopathic medical school and become a naturopathic physician, or you might not be a healthcare provider, but you just want to get healthier and know what's out there. It is fair to understand the differences in titles. I will do this now just to compare everything about naturopathy, and then in 2 or 3 slides, we'll have a comparative analysis of different titles and ranks, academic ranks around the world, so you know what to find out there. All right. So let me start by asking you this question right away. What is a naturopath? Please let me hear your voice or use the chat. What is a naturopath? Okay. Who is this person? A person tells you, oh, I went to my naturopath the other day. I feel so much better. Again, please don't use Google for now. Just tell me what you think this person is, just to verify the common knowledge or the common perceptions. Nothing to do about you, but the way those things are perceived in the world.
Is a naturopath someone who practices natural medicine?
Yes, spot on. Thank you. Yeah, absolutely. Yeah. Someone who specializes in natural medicine, that is also true. I think it's a doctor who does not use allopathic biomedicine to treat a patient. Not necessarily. It could be, and we'll see the difference there. Yeah. Generally speaking, yes. That's a good assessment. What else? Give me a few more comments, and I'll give you the full answer. A practitioner who uses natural medicine to treat a patient, holistic-based practices. Yes, I would say that. Yeah, absolutely. I also like the fact that you put treat parentheses there. Yeah. A doctor that puts great focus on preventive medicine and lifestyles. Yes, absolutely. That is spot on. Think of how the environment culture impacts a patient. Yes, spot on. Yes, it's also true. Very much so. Definitely patient-centered, but in a holistic sense. So internal and external environment. Yes. Right? All right. Anybody else? Someone who, in addition to traditional medical training, has been trained extensively in natural herbal treatments and considered the root of health issues as opposed to treating the symptom alone. I really like that one. Yes. I like this for 2 main reasons. The first one is that it's in addition, okay? A common misconception of natural medicine, specifically naturopathic medicine, is that, well, if you cannot get in a real medical school, I guess you can become a naturopathic doctor, which is really false. And we'll see that how false that is, okay? So it's definitely in addition, all right? And then I really like the fact that it goes to the bottom of the problem, more specifically the root, which is a much more holistically minded term. So thank you. I really agree with that. What else? All in agreement so far. We are in really good shape if you know this thing about naturopathic medicine in general. All right, so feel free to add more comments. So let's begin with some definitions. I will write a few labels here, a few titles, okay? And then I will explain the difference between them. Naturopath, naturopathic practitioner. So this, so copy and paste. Naturopathic doctor, and naturopathic physician. More comments. Naturopaths are patient-centered provider who work with their patients to come up with plans of care treatment. Yes, another important link. They work with their patients. This should be something that every doctor should do, but very often this is hierarchical, top-down knowledge where I am the expert and tell you things that you don't even know about yourself. So just follow my lead. That's very true. So those are the main categories. There's 4: naturopath, naturopathic practitioner, doctor or physician. And then you have parallel definitions such as natural, fill in the blank, so natural doctor, natural physician, etc., etc. Osteopathic, again, fill in the blank. Chiropractic versus chiropractor, okay. Holistic, traditional, alternative, integrative. Sure, you can just invent your own label, like a complementary doctor, but these things that I just mentioned are the ones that are used in a clinical and legal sense, okay? Now, and of course, there are many other professions. You can be a nurse who's also a doctor, like a doctor of nursing practice, of course. It can be a doctor in social work that decides to utilize holistically minded strategies for the work. But for now we're just working on medicine, okay? And then we'll branch on with other professions. So let's assume that you finish your bachelor degree, okay? You got your first 4-year degree, and then you want to become some sort of doctor, some sort of practitioner that can see patients, treat them, and possibly bill patients, okay? Working either in private practice or for, let's say, a clinic or a hospital. So that's the general picture. What is the difference? Well, the term naturopath per se, it's not registered or legally certifiable, okay? Now, can anybody call themselves naturopath? Well, careful, because it's a very gray area, but naturopath alone, it's not really something that is recognized as such. And that's why we have terms as naturopathic practitioner, doctor, or physician. Now, the website I just showed you is the website where you can find all the information about licensing mechanisms, okay? And the NPLEX is the national board examination to become a naturopathic physician, okay? The same one as a USMLE for corresponding medical schools, okay? The problem is this: not every state in the union recognizes naturopathic doctors as primary care providers. So I want to give you a few examples. Vermont is certainly one of such states. Not surprising, we are very green-minded, green-oriented in Vermont. So in Vermont, you become a naturopathic physician the same way as you become any type of physician. You have your 4-year bachelor degree, then you have to demonstrate knowledge in terms of academic credits in all those courses that are usually required to go to medical school, from physics to biology, et cetera, et cetera. You go to a 4-year medical school that is called a naturopathic medical school. Then you take your board exam, just as any other medical schools. And then if you want, you can specialize in more, branches. You can become a naturopathic physician specialized in pediatric care, in psychiatry, and so on and so forth, okay? So in Vermont and in 20 more states, I believe, 19 more states at this point, a naturopathic physician is a primary care provider, is a physician, doctor of physician, and is, for the sake of legal and clinical aspect, exactly the same as an MD, okay? The term is ND, okay? And the equivalence is with MD. There are, however, some restrictions. Since by federal law, an ND, it's not mandated, it's not forced, legally speaking, to continue their post-degree academic career with a internship or rotation, then ND, for the most part, are not allowed to perform major surgical procedure, okay? They can perform some level of microsurgeries, but you will not find an ND who practices as a cardiothoracic surgeon or a neurosurgeon. It's quite unlikely, okay? It's not completely illegal, but the framework in order to go from ND to post-MD specialization, it's still up for debate. Okay, it's a state-by-state situation. Okay, so if you're in Vermont, then you want to become a family physician, you want to become I don't know, a holistic practitioner with their doctorate and their clinical private practice and patient, you can certainly do that as long as you are a quote unquote a real ND. So you do everything according to the law. So real naturopathic medical school, real exam, and real rotation. Okay. In New York, it's not like that. So across the pond, things are a little more different. First of all, naturopathic medicine, it's not recognized as an independent field, which means that you can certainly call yourself naturopathic doctor or naturopathic physicians if you graduate from naturopathic medical school, but in practice, you might not have accessibility to Medicaid and Medicare as you have in Vermont. That's why in other states, you have other types of acronym, such as NMD, naturopathic medical doctor, that at times are used as a substitute for ND. Now, you will find a lot of online degrees that offer NMD as a doctorate. Now, while these degrees are not illegal, they're always considered further education. So the term doctor per se, as we will see, okay, the term doctor does not mean physician legally, academically, or scientifically. So technically speaking, you are allowed, if you graduate from such degree, to refer to yourself as doctor, but you will refer yourself as doctor the same way as you would refer to yourself as doctor if you graduate with a doctorate, let's say in mathematics. Okay. It's not illegal, but it could be confusing if you are in a healthcare setting. Okay. And so this is, for instance, New York, okay, the state of New York, because it's really close to us. If you go on the opposite side, you cross the border in Canada, things are similar. So in Quebec, you have pretty much the same rules and regulations as you have in Vermont. So ND are equivalent to MD, but then you have other types of degrees that do not grant access to board examination. And so you can refer to yourself as a naturopathic practitioner. To make things even more complicated, you have degrees that kind of merged together. We will talk about this in future weeks, but for tonight, I really want to be clear. So since I mentioned osteopathic and chiropractor, what about degrees such as DO or OD and CD or DC? Okay. So DOOD, it's a doctor of osteopathic medicine or osteopathy doctor, and CD is a doctor in chiropractic medicine or a chiropractic doctor. Okay. What is the difference? We will talk about the history, more specifically in week 8, I believe, but the general idea is this. So there were practitioners in the mid-1800s in the United States that were really focused on manual / massage, stimulation, manipulation therapies. And that was the origin of osteopathy in medicine. Okay. The origin is really the United States in the mid-1800s. Now, by osteopathy, really the term itself has to do with the same root of the term of naturopathy. So what do we mean by pathy in this context? There are two possible interpretations. One, which will be more etymologically correct, which has to do with pathos. Okay, pathos in Greek means passion, emotion, or misaligned emotion. In other words, disease, illness. Okay, so naturopathy is a type of practice that uses nature to treat a disease, and a chiropractor, so someone who uses osteopathy, uses osteos, so body alignment, bones. Osteos has to do osteology with bones and skeletal structure, skeletal muscular structure, rather to say, from an anatomical standpoint, to treat disease. Okay. So at first, the term was osteopathy as a whole, but then the United States and Canada took two different pathways. So an osteopath in the United States is an osteopathic doctor. So a person who goes to a DO medical school, and for the sake of legal, ethical, and clinical perspectives, is exactly the same as an MD. Okay. So in the United States, this is fully equivalent in every sense of the term. You can be a neurosurgeon, cardiothoracic surgeon, psychiatrist, generalist, oncologist, regardless if you are a DO or MD. Now, for the ones of you that think of DO as a plan B MD, this is actually not true. It's the opposite. An osteopathic medical school has exactly the same amount of training, including all courses, all credits as an MD medical school, plus the osteopathic element, which in itself is considered an alternative and complementary form of medicine. So manual therapy, massage therapy, realignment therapy. So you could say that this is usually in the United States the correct equation. What is a chiropractor? Chiropractor is this. Okay. This does not, so a chiropractor is what happens to a person that goes to an osteopathic medical school and you remove the MD from the osteopathic training. This does not mean that chiropractor is less trained, or the chiropractor is a less informed physician or less informed practitioner. What it simply means that a chiropractic school is entirely focused on the practice itself. Okay, so realignment, manual therapy, and osteopathic and manual therapy. Okay. Versus at this point in the United States, a DO, generally speaking, does everything as an MD does. So in practice, the likelihood that a chiropractor is more aligned with complementary, alternative, integrative, and holistic perspective is higher than an osteopath in the United States, okay? Does that make sense so far? Good. In Canada, things are different. So a doctor of osteopathy is the same, not as an MD, but as a chiropractor. Okay, which means that this person can be their own professional, can have their own private practice, they can build a client, but they cannot perform surgery, for instance, okay, or psychiatry for that matter. Okay. All right, so let me see if I can. So for everything else, holistic doctor, traditional doctor, alternative, integrative doctor, depending on the degree, you'll be able to do more or less. For instance, many MDs can continue with a specialization in integrative medicine. And so that will be synonymous with other forms of specialization. So you go for 4 years of medical school, and then you go for a rotation and future training in oncology. Some people decide instead to go to a specialization in integrative medicine. Okay, so they're MD with further training. Same thing for traditional medicine. Now, are there degrees that offer theoretical degrees to become a traditional naturopathic doctor? Sure, they're legal, and some of them are extremely good online program. But of course, as you would imagine, if the program is entirely online, what is lacking is a direct patient care. That is, it's kind of obvious, is required to become a doctor seeing patients for real. All right, so that's the first introductions to the practice. So if you have more interest on this or that specialization, I'll be happy to provide more description. But for now, that's what I would like you to remember. If you hear an RC track, that's my son. Lucas, puoi andare su, per favore. Grazie. All right, let me continue with the slideshow, unless there are more questions. Peter, Lucas. All right, so the next one, other useful references. The first one is the ANMC, which has more to do with the training rather than with the practice. This is the association, the American Association, National Association of the licensed naturopathic medical schools or medical colleges. To this day, there are 6 accredited medical schools in the United States. One is in the process of being accredited, okay? Which means that you might find a lot of medical schools that offer integrative courses, but not full naturopathic medical doctorates, okay? UVM is one of such schools. UVM is actually one of the oldest medical schools in the nation, but we don't have a full naturopathic medical doctorate. We have certificates in integrative medicine, courses in complementary alternative medicine like this one, but we don't have a full ND program. So most of physicians graduating from UVM, what they usually do, they graduate with an MD, for instance, or a DNS or a PhD, and then they specialize in the future in naturopathic practices, okay? The NVS or NVS, pronounced in English, is the equivalent of the ANC in Switzerland, okay? Yeah, the National Association of Naturopathic Colleges, and the ANME is the equivalent for the European Union, all right? And all these websites contain information in the main languages of Europe, so Italian, German, and French, as well as in English. So if you want to, have a general idea of the comparison, those are good websites. Now, I want to be mindful of the time. The next slide, it's a slide that tells you a little bit about the comparative analysis from the perspective of academia, okay? Now, the title here is, are natural doctors real doctors, okay? And for this slide, you have a corresponding slide here with some video to explain the difference. But for now, I just want to point this out. Now, first of all, let me make it a little bigger. Now, some of you are not native to the United States, so you may be already familiar with this. And this is especially important if you're planning to either have some sort of international practice, rotation, internship, or workshop, or the opposite, if you already completed some undergrad or graduate training abroad and then you came to the United States. The first thing to keep in mind is that the term doctor does not mean physician per se, okay? And it's something that's universally valid. So let me just share something here outside of the PowerPoint. And this has to do with a very brief history. So throughout the history of medicine, there were 3 levels of academic ranks or attainment, I dare to say. The lowest of the lowest was surgeon. So surgeon is level C, okay? Above surgeon, you have physician, level B, and above physician, you have doctor, level A. Let me explain what do I mean by that. Does that mean that a doctor, a cardiothoracic surgeon with 30 years of career, plenty of experience, and published peer-reviewed paper, it's less than a doctor? No, of course. In the United States, those 3 terms are somewhat equivalent, okay? So why is the case that surgeon considered less than a physician and physician considered less than a doctor? Well, historically speaking, in the traditional sense of university career, which is still the same way as those terms are utilized outside of the United States, including Canada, by the way, the surgeon was considered the hands-on person, okay? So you could say that the surgeon was the, I really don't mean any disrespect whatsoever, but the term etymologically speaking was really to the doctor's butcher, so to speak. The person had a lot of practical knowledge in anatomy and physiology, knew how to cut, but did not or was not required to have any knowledge in biology, chemistry, physics, or any theoretical knowledge. So the surgeon for the longest time was the assistant of a physician, okay? The physician was the one that knew how the body worked and told the surgeon where to cut. The surgeon knew how to cut, okay? But the physician was the one who had the knowledge. The doctor was the one above the physician who had both practical knowledge, chemical, biological knowledge, as well as theoretical knowledge. Only a doctor could teach in a school, a medical school. A physician or surgeon was not allowed to. Now, how is this applicable to the modern time? Well, to give you a straightforward example, this is something that it's kind of a joke, but it's historically accurate. The very first years of graduation at Harvard, physicians at Harvard and surgeons at Harvard were not required to know how to read and write. This is something that sounds completely, nonsensical, but the idea was this: you become a doctor, professor if you have all your academic knowledge, but in order to be a good surgeon, you just need to know how to operate. That was the idea. So does that mean that the training in the United States to become a doctor, a medical doctor, is different than what you can find, for instance, in England or in Quebec? Absolutely not. In practice, a medical school in the United States is exactly the same way as the English counterpart. The Canadian counterpart is not any less, but the titles are different. So if you graduate from a medical school, let's say in Montreal or in London, if you graduate from Oxford and Cambridge, your degree will not say MD, because if you go to medical school or a medical college, you don't go to a doctorate. You go, quote unquote, only to a medical school. Therefore, your degree will be MBBS, which stands for a medicine bachelor and Bachelor of Surgery. Okay. Now, why do I mention this? I also mention this for your own sake. Let's say that if one day, you graduate with an MD from a United States-based medical school, and then you go to Oxford to give a lecture in academic setting, and you refer to yourself as doctor, that might be perceived as arrogant, quite so, because upon graduation, all physicians outside the United States refer to themselves as respectively Miss or Mr. Okay, if only they complete future training and they indeed get either a PhD or a MDR, which is a higher doctorate in medicine. At that point, they can refer to themselves as doctors. Now, this is true for academia, not to be perceived as unnecessarily arrogant. Of course, as a physician, as someone who graduated with an MBBS, you can certainly say, well, today I will go to the doctor, and you really mean you're going to see a physician. That's totally fine. The danger, though, it's not really a danger, but the confusion might arise because in most Europe, to say I'm going to a doctor, this could mean that you can go to a surgeon, to a physician, to a psychologist, to a social worker, to a psychotherapist, to a massage therapist, to the nurse. You're going to a person with a doctorate, okay? To the point that very often nursing staff are higher in rank than physicians, because certain nurses did obtain a full doctorate, a doctorate in nursing, versus a medical degree. It's always considered an entry-level professional degree, and therefore it's lower in ranks than a full doctorate, okay? So I mentioned this because you might find certain naturopaths that do have also a PhD, and they are referred to as doctors outside the United States, not MDs. Okay, so this is just something to know from the perspective of research papers, especially if you actually read the initials in the authors of a peer review paper, and you might say, well, MBBS, well, this person has only a bachelor, therefore it's not as qualified as an MD. No, an MD, an American MD is considered a bachelor degree outside of the United States, right? Again, nothing to do with the quality of education or with the length of education or even with the credits given. It's just a different of theoretical and historical reasons. So to go back to the slide here, I don't want to spend too much time here, but you have a comparison of different systems between the United States, Europe, and the former USSR and the Eastern Bloc, okay? So you will find things such as level 1 bachelor degree, okay, level 2 master degree, postgraduate, and then entry-level professional degree. Then, while we all have postdoc experiences, In Europe and the United States, you have the so-called higher doctorates. They are DSc, Doctor of Sciences. They're not Doctor of Sciences in the American sense of the term. There are doctorates that are only awarded by honors, okay, usually based on the publication of several books, several peer-reviewed publications, and with at least one or two previously obtained doctorates. Okay, so this is just something to keep in mind. All right, great. And if you want to know more about this, feel free to ask me, but this is something that I would like you to remember. It's almost 6. So the second part of this slideshow, I'd really like you to do on your own. But slide 14 are, you have 3 URLs, 3 YouTube videos that we'd like you all to watch after we go off with Zoom tonight. Just to give you a general impression, okay? And then next week, we will start our Zoom meeting with the discussion. So rather than me starting with a lecture, next week, I would like to ask all of you to start a conversation and give me your impression about these 3, okay? I don't want to say much about this, okay? Because the video is pretty self-explanatory. And Dr. Weil, it's very, very famous. This is just a very short interview of a series, so you can watch the whole playlist if you so choose. Candace Pert is a neuroscientist and pharmacologist, very well known because of the discovery of the opioid receptors. And Edzar Ernst is a former naturopathic practitioner, a very fond supporter of homeopathic medicine that changed his mind and did a 360 and became one of the most renowned critics of anything that's naturopathic or natural medicine based. This is an interview done on RT, which in itself is a controversial state-owned media, okay? But you know, I would like you to watch these videos in preparation for the discussion next week, okay? Again, in the past, I create discussions on Blackboard, but to make this course more interactive, I really want to do this live. So please watch this video tonight, and then next Tuesday, we'll talk about that. Since we have like 10-ish minutes left, I will make a selection of slides to discuss with you, and I would like to do this. The first thing is this slide here, clinical reasoning. Hermeneutics is both theory and practice of interpretation. And then there is a quote here, and the quote has to do with neuroimaging looks like rationalism, but is empiricism, just observation without explanation. This goes back to what we said about those 9 parameters, the Bradford Hill 9 rules, okay? Which is exactly the correct way to interpret complementary medicine. The example here is in neuroimaging, because the idea is in psychiatry and neuroscience, very often we hear terms such as, well, if you can show it in the brain, that means that this thing is real, okay? As if what it's not brain-based is less real. Example, well, you're not really anxious because your brain doesn't indicate that your cortisol level is skyrocketing, your amygdala are going crazy, and your HPA axis is overactivated. Therefore, you're not anxious. But the point is that you might still feel so, okay? And this does not mean that it's less real, less important, not even from an ethical standpoint, but from a very scientific standpoint. So what Robin Bloom says, and Robin Bloom is one of the most important contemporary philosophers of medicine that analyzes the scientific method in medicine, she clearly says that observing things is very important, but observation alone does not contain any form of explanation. For instance, so if you're looking at the brain, right, and if you say, well, okay, let me grab a piece of brain here, one of the model I have here. So you look at the ACC, for instance, right here above your hypothalamus. Above the hippocampus, the ACC, the anterior cingulate gyrus, that it's connected to things such as moral ethical decision making. It's the connection between your memory production in hippocampus and your prefrontal cortex. So it allows you to determine your role in communication with another human being, for instance, okay? Just because the ACC lights up, it does not mean that you can infer anything about the content. The only thing you can say is that every time a person is dealing with problems on the level of making moral, rational, ethical decision. For instance, should I go for a surgery or should I wait? Then this part of the brain lights up. So it's a neural correlate, not a neural causate. Okay, just because something is observable, it always means that it's like a shadow. It's always present if this part of the brain is responsible for it, but it's not the thing itself. I hope this makes sense. So this is one slide I want to share with you. The next slide I would like to share with you right here, we can skip the philosophical part here, has to do with some history. So the first one is this, okay? We're talking about what we left at last week. We mentioned this knowledge between East and West and the criticism of separating East and West. This person here is Paracelsus. And Paracelsus, if you remember, is one of the last alchemists and one of the first chemists, okay, 1400 German Renaissance. And he uses the ancient medical tradition to discuss the origins of diseases. So similar to what the Brethel-Hill criteria do in medical sciences, he uses 5 points to determine how we get sick. Okay, so the 5 main influences or origins of medical illnesses, diseases, and disorders. Okay, the first one is the influx and influence of the stars. As you can imagine, there was a lot of astrology present in medieval Europe and throughout the ancient world. So the idea was that there was some sort of pressure and influence from the stars. The second one was really biochemistry. Okay, you get sick through the poison absorbed or inhaled by the body. Okay, veneni, it's the genitive of venenus in Latin for poison. So a biochemical problem. You get sick because there's something inside your body you ingest. Third, ens naturale, the natural predisposition and constitution, the very fact that you might be immunocompromised. Fourth, ens spirituale, and ens simply means being or entity, okay? The influence of the spirits. This will be really the biopsychosocial model. In this context, spirits not in a transcendental religious sense, but spirit as in your psychological, rational, and mind processes, okay? Finally, of course, because of the construct, the influx and influence of God, or in ancient tradition, the God. So there's something spiritual about it. Now, one of the things I want to specify is the difference between illnesses, diseases, and disorders, okay? In modern terms, those are to some extent synonymous, but they have very different origins. So illnesses, let me just do this actually. Let me copy and paste here in the chat. And if we finish now, that's probably enough. So I will ask you to review the rest of the PowerPoint on your own. All right. So illness, diseases, and disorders. Illness, it's a construct from ill, which comes from a Germanic term, okay, that is übel with the R, okay, not with R, that really means nauseated, physically not at ease with oneself. There's some biochemical process. So this is really connected to the theory of temperaments, those humors, those fluids in the body. Disease is not being at ease. Okay, so this is very much connected to a holistic perspective. You are out of balance. Your yin and yang are not aligned. Okay, now in modern times, we use disease as a biochemical reaction too, because we use only biology, the biomedical model, but it's the same attitude you can find in natural medicine. And disorders, it's more the mind-body connection. Something is not in order in the alignment between the spiritual mind and the physical body. Okay, so this is what I would like you to bring home for now. The rest of the slideshow is really about a parallel between mind-body medicine in a biomedical sense, including the biopsychosocial sense, and the other one from the CAM perspective. Okay, so you'll see reference to pseudoscientific practices such as physiognomics, such as phrenology. And just to give you a little hint, so physiognomics was this hybrid psychological medical study that claimed to be able to identify certain disorders or behavior just by looking at someone's physical appearance, especially facial features. and then has a lot of negative ethical repercussion in things such as eugenics, for instance, okay, to claim that certain dolichocephalic brains and heads were more prone to have a higher IQ than others, or that certain traits were preferable than others. And the other one is phrenology, which is the old precursors of neurology and neurosciences, that claim that because of certain bumps on your skull, you could predict your prevalent or dominant biological and psychological response mechanism. Of course, none of this was true, but it's connected to a lot of debate within traditional medicines and the way our genotype, our genetic makeup, manifests itself in our phenotype, in our external characters. All right. Any questions or observation before we conclude tonight? So homework, please review the videos attached and the one in the module. Look at the interview. It will be great if you could look at the whole, how you call it, the playlist. All right. Well, thank you very much. And I will see you all next week.